Hi everyone, welcome to my workshop today. I am Dr. Lauren here with Healing Touch Chiropractic. And what if asthma is not just a lung problem? When most people hear the word asthma, they think about the lungs. They think about wheezing. They think about inhalers. They think about difficulty breathing. But like I said, what if asthma isn't just a lung problem? What if asthma is actually a sign that the body is struggling to adapt to its environment? So today I want to give you a different perspective on asthma. Not because medications don't matter, not because the lungs don't matter, but because there is often a bigger story underneath a diagnosis. So, what is asthma? Asthma is considered a chronic inflammatory condition of the airways. When someone with asthma is exposed to a trigger, their airways can become inflamed, produce excess mucus, tighten the muscles around all the airways, which makes it really hard for air to move around the lungs. Symptoms can include wheezing, shortness of breath, chest tightness, chronic excessive coughing, difficulty keeping up with physical activity, and oftentimes trouble sleeping because of the overnight symptoms. And the medical model often focuses on controlling those symptoms. But one of the questions that we should always ask is, how come not everybody's body responds this way then? Why is one child different from the other? Why does one child grow out of it and one doesn't? So where does asthma come from? Well, unfortunately, there is not just one cause, but the research does point to several different contributors, and the first is genetics. So it says that some people are simply more likely to develop asthma based on family history. The second is environmental exposures. Things like pollution in the air, secondhand smoke, mold, allergens, and really just repeated respiratory infections can all increase the risk. The third is immune system development. So research is increasingly suggesting that early immune system development plays a big role in this. So things like birth interventions, antibiotic exposure, where someone's gut health is, how many early childhood infections they have, these all influence how the immune system responds to everyone's environment. And lastly, nervous system stress. Well, I don't know that it's obvious, but this piece often gets overlooked. The lungs do not operate independently. They are under constant regulation of the nervous system. So every breath that we take is being coordinated by the brain, spinal cord, our autonomic nervous system, to our diaphragm, our rib cage, and all of the breathing muscles that are part of that. So if the nervous system is struggling to adapt, then the body is often going to struggle to regulate itself. So, what does the nervous system have to do with asthma? Well, your autonomic nervous system has two branches. We've got the sympathetic and the parasympathetic. People often know about these as fight or flight or rest, digest, and recover. The lungs are heavily influenced by both of these symptoms. So changes in nervous system activity influence the person's breathing patterns, their respiratory muscle function, the way that their body responds to immune challenges, and the way that their body responds to inflammatory responses. So that we also know that stress can trigger anxiety attacks. We also know that poor sleep can often make asthma worse, and that anxiety can also worsen all of those symptoms. But I just want to point out that none of those things are lung problems. These are nervous system problems affecting the way that the lungs function. And that is one reason why we care so much about making sure that the body can adapt to stress more efficiently. So, what does research say about steroids? inhaled corticosteroids are one of the most common treatments of asthma. And it is important to understand that they have helped millions of people. Research does consistently show that it can help reduce inflammation, reduce asthma attacks, improve symptom control, and those are significant benefits. But steroids don't answer the question of why somebody developed asthma in the first place. These are helping manage the symptoms of an inflammatory response. They are not rebuilding nervous system adaptability. They are not changing the way that the body reacts under stress. They are not improving movement patterns, stress, or resilience. So while medication can be incredibly valuable, many families are now looking for ways to support the body just beyond symptom management. So, where does chiropractic fit in? What we do is we help the nervous system to function efficiently. The brain and the body are constantly communicating, no matter what's going on. And when the body is carrying excessive stress, which is shown in tension, compensation, altered movement patterns, the nervous system often has to work harder to coordinate normal function. And so our goal is to improve communication and adaptability. We want the body to become more efficient, more resilient, more capable of handling life's stressors. Some studies show within our own office that we have done on patients that we see fewer symptoms, better sleep, less medication use, and improved activity levels for longer periods of time. The most consistent finding isn't necessarily a dramatic change in lung function tests. It's that people often feel and function better. So from a clinical perspective, that is something to pay attention to. In our office, we often see kids with asthma also experiencing things like chronic ear infections, allergies, sleep challenges, digestive issues, anxiety, and really just emotional regulation challenges. What that tells us is that we're often looking at a much bigger nervous system picture. So the goal then becomes, we're not just going to simply help somebody breathe better. We want to help their entire body function better. Because when the nervous system becomes more adaptable, the body becomes more adaptable too. So, what can families do? Beyond medication and chiropractic adjustments, some of the most impactful things that families can focus on: prioritizing sleep, encouraging daily movement, just simply spending time outside. We want to make sure that their gut health is supported. We want to make sure that their stress is being managed. We definitely want to reduce inflammatory food exposures, because the goal is a bigger capacity to take on life. We want to build a body that can handle more life. So, asthma is not simply a lung diagnosis. It's a sign that the body is responding to the world in a very specific way. Medications sure can be necessary, but they are not going to take care of the deeper problem. That is just the start of the conversation. When we support the nervous system, we improve adaptability and help the body function more efficiently. We are often creating opportunities for the lungs to function better, which is going to change health in so many different ways from there. Because the question isn't simply, how do we stop wheezing? It should be, how do we help the body become more resilient, more adaptable, and more capable of thriving. That's the conversation that we should be interested in having. If you guys have any questions regarding chiropractic care and asthma, feel free to comment on this video, or you can call or text our number, and let's start some different conversations, and let's just change lives. Make people function better, make people feel better. Let's help people get back to who they want to be. Bye, guys.